Homeopathy was invented by Dr. Samuel Hahnemann almost 200 years ago. It is a branch of science, and that is how he invented it. And he himself made 5 different versions of homeopathy. He, repealing the previous ones, he made modifications, and he reached to the point where there were 5 different versions of homeopathy, all done within his own lifetime. He was a very progressive-minded person, and therefore he could invent something like homeopathy. But ever since, homeopathy has become quite static. It remained quite static, barring very small changes that happened in the following, let's say, 100 years. There were some early pioneers of homeopathy who had their independent styles, but those were minor modifications, keeping the fundamentals more or less intact. However, these needed to change because homeopathy is not a portrait. It is therefore a dynamic branch of science. It needs to evolve to match the changes in circumstances of the medical landscape. Homeopathy was properly applied in the real practical world of a busy clinic serving hundreds of prescriptions a day for the first time in the world by my grandfather, Dr. Banerji, when he set up his first charitable clinic in 1918. And it was in a very small village where he set up his clinic with a total population of only 300 people. But very soon that clinic became busy, serving hundreds of prescriptions a day, served by a group of homeopaths whom he trained. That was, in a way, the birth of practical homeopathy, where it could be applied to the real masses and served to deal with the different kinds of health problems of people. It was a departure from the traditional homeopathy, which required a huge, lengthy case taking to elicit all the symptoms that a patient suffered from, and then choose one simillimum, that means one medicine that could match the largest number of symptoms from all the medicines of the Materia Medica. There was a change. There was the fundamental change that my grandfather did was to identify specific medicines for specific conditions. So, in an outdoor patient environment, when a patient reported with a problem, immediately the medicine could be selected and given. And obviously the proof that these worked was in the numbers that started growing, that the numbers in that small village started growing. Patients from all over the country started pouring into that small village to avail the treatment because of the efficacy that these prescriptions demonstrated. There were hundreds of homeopaths around the country, and there are hundreds of thousands of homeopaths around India today. But there is a difference, of course, in the efficacy of the treatment that is delivered. The efficacy has happened, or the increase in efficacy has been achieved exclusively by virtue of extensive clinical research, particularly trying to understand why classical homeopathy fails in certain circumstances. So that is what the focus of the treatment was. According to classical homeopathy, this should have been the selection of medicine, but when it is applied, it is not working as often as we would like it to. So the research was on failures leading to this beginning or a rudimentary process of selecting medicines based on specific conditions. In that process, lots of other considerations were also brought in, and this would be the identification of specific potencies along with the medicine. The concept of homeopathy in general is that the smaller the potency, the weaker it is, the higher the potency, it becomes stronger. Fundamental change was made to this concept by my grandfather, and it became a specific medicine with a specific potency for a specific condition. Now, this is a fundamental change brought about by clinical research and observations in the thousands. It was not based on 1 or 2 or 10 or 15. It was thousands of observations that led to this conclusion, and not only just hypothetical conclusions, but verification of the conclusion that was drawn. So we have suddenly a situation where a medicine called Bryennia alba, it's not that 6 is weaker than Bryennia 200. Bryennia 6 is a different medicine than Bryennia 200. So this completely changes the actual fundamentals of medicine selection in homeopathy. And how different? Bryennia 6 is used for diarrhea and Bryennia 200 for constipation. That different. So it is no longer this is weaker and that is stronger. This is a completely different medicine. That Bryennia 6 is a completely different medicine to Bryennia 200. This is just one example of hundreds and hundreds of observations, and therefore conclusions and inclusion of these conclusions in the treatment process that was adopted. So this is the beginning of evolution of what I call modern homeopathy. This is a departure from some of the concepts of classical homeopathy to another version, shall we say, and say that this is modern homeopathy, the beginnings of modern homeopathy. The process continued to evolve under my grandfather for several decades, and again under my father, Dr. Parimal Banerji, for again 4 decades at least, maybe 5, and I, of course, am carrying on this process of evolution for the last 20 odd years. This is very important because we really cannot be stuck in time with a subject of science, particularly medicine, such as homeopathy. The evolution under my father was carrying forward the ideas that were initially proposed and verified by my grandfather, and then into a domain where the groups of symptoms were identified to be occurring together. So what my father proposed was that the fundamentals of homeopathy was what can be produced can be cured, and therefore the reverse is also true. What cannot be produced cannot be cured, which means the symptoms that have not occurred together or have not started together obviously cannot be reversed together also. Just like, let's say, the same person obviously did not have constipation and loose motion in the example of Bryennia that I just gave. So here, obviously, there are a group of symptoms which always occur together. So if there is a totality of symptoms of a person, then there are multiple disease influences that have affected the person at different times, at different levels, and that has led to the totality of symptoms. That means there are small groups of symptoms which always occur together, and that needs to be reversed separately. They cannot be arbitrarily clubbed, and we cannot therefore arbitrarily club all these symptoms and try to find a medicine that can reverse all of them together, because they did not occur together. So this is one of the several innovations. Again, I mean, I'm just trying to summarize, and I'm going to say that this is one of the important steps that was taken in the evolution, where there are multiple groups of symptoms in the person. The other aspect of the innovations and the evolution or contribution to the evolution of homeopathy by my father is the recognition of finite groups of people. Just like finite groups of symptoms that always occur together in a person, which needs to be neutralized separately using homeopathic medicines, the recognition of groups. Let's say if you see only 10 people, all 10 of them are individual, they are all different. But if you expand that group, if you have 1,000 people, all of them, if all of them are subjected to the same disease influence, then you will be able to see patterns emerging. So they are not individual as individual as fingerprints, but there are patterns that will emerge when these are seen in the bigger context. In the sufficiently big statistical context, you will be able to easily identify these patterns. And when you will find them patterns, then of course they are of the same constitutional reactionability. That means, the same disease influence that was affecting the person was, the reaction to the disease influence of a person was similar or same as several others under the same disease influence. So these patterns can emerge. And that is another consideration, that it is possible therefore to create some standard methods of treatment which can be replicated with the same degree of efficacy if you are able to recognize these patterns or these constitutional reactionabilities. The third leg of evolution that has happened over the past 20 odd years under me and my team has been to take full advantage of the developments in modern medicine knowledge about diseases and the diagnostic tools that have evolved to enable us to measure the disease velocity and also the parameters that indicate the state of the diseases. This is the aim of our treatment, or the aim of our research is to create treatment processes that are independent of any one person's ability, independent of the skills of any one person, because these are disease-specific treatment processes that are replicable, and they are significantly less subjective than earlier versions of homeopathy, where the emphasis was all about symptoms. Here, in this version of homeopathy, which is called Paramesh Banerji Advanced Homeopathic Protocol, we have specific disease-oriented processes which include not just the medicines that are to be used, but also the way the case taking is to be done for that, the treatment strategy that needs to be adopted, the treatment response strategy that needs to be focused upon, and of course the support system that needs to be provided to enable us to treat complex and sometimes critical disease states. So it is a significant step forward which relies less on symptoms and subjectivity and more on objective evaluation of the patient's condition using tools that are machine dependent. So these would be like blood test reports, these would be ultrasound, CT scans, MRI reports, and now even PET CT scan reports. The change is very, very systematic. The change is not arbitrary. It has got a pattern, it has got a deliberate understanding of the disease process at a very fine granular level. For example, let's say a person reports with stomach pain. The question to be asked is the pain radiating to the back? If yes, then there is a reasonable chance that this is a possibility, that there is a possibility of this being a pain of pancreatitis. Immediately there are certain other questions that need to be asked. Are you having weight loss? What else are you having? Have you ever had an ultrasound of your upper abdomen? Have you had a blood test which includes liver function test and particularly serum amylase and lipase? So these are the case-taking approaches that are automatically selected by anyone addressing such a case in our telemedicine center or clinic. So this is very much process driven. We would be doing these investigations. We are going to take note of the current parameters that these case-taking, these investigations give us, and when we want to do a treatment response assessment, we would not only ask about the pancreatitis pain attacks, we are also going to rely on the serum amylase and lipase values, the body weight parameter as well. And this is very important because if we are not going to follow some parameters such as blood reports, it will be very difficult for us to do a proper treatment response assessment. And these are a significant departure from classical homeopathy. Why? Because there is no mention of serum amylase and lipase in any of the homeopathic books of 150 years old, from 150 years ago. So these did not exist then. These have been incorporated into the treatment process that we have created under Paramesh Banerji Advanced Homeopathic Protocol that my team implements. Please remember that this departure from subjectivity enables us to also implement treatments for complex and critical diseases where subjectivity cannot be the only source of gauging what is the treatment response we are able to elicit by implementing our treatment. And because our treatment is less subjective oriented and is more dependent on reports, we are able to also implement these treatments on telemedicine, which is a very important development. So we basically have a healthcare for the connected planet. Today we are able to reach any person in the world by phone or email, and also recently by video, to enable us to project our expertise to patients wherever they are in the world. And because our treatment response is guided by the findings of the reports, we are able to remain on track about the patient's condition, even with limited communication with the patient himself or herself.